This presentation is an overview on autism, what autism is, how it is diagnosed, signs and symptoms, treatment, and how speech pathologists and teachers can help a child with autism. Autism is a developmental disability characterized by social, communication, and language problems. Many people with autism also exhibit repetitive behaviors and patterns, such as hand flapping, limited interest, imitating speech, or sensory issues. Every person with autism is different and experiences different signs and difficulties. Autism is a spectral disorder, meaning that people can have mild to severe cases of autism. Speech-language pathologists may help diagnose autism as part of a team of specialists, such as psychologists, pediatricians, occupational therapists, developmental specialists, neurologists, and physical therapists. However, an SLP may not formally diagnose a child with autism by themselves. SLPs may come across a child with potential autism first because many times the first warning signs are impaired communication and social skills. Usually autism is not formally diagnosed until around age 3 or later. There are many common signs and symptoms of autism that involve their social skills, communication skills, and behaviors. It may be difficult for a child to focus and share attention on something with another person, or it might be hard to share toys or make and keep friends, as well as hard for the child to understand feelings. It also may be difficult to understand, talk, read, or write, as well as engage in conversation, learn to read and write, and follow directions. It might also be difficult for a child to transition from one activity to the next. A child may be extra sensitive or not sensitive enough to certain sounds, textures, and tastes. The child may have limited or unusual interests. It may be hard for a child to stay still, and they may spin, flap hands, or rock back and forth. It is important to note that a child may have been developing typically for a while, and then they appear to have lost many of the abilities that they had before.
The exact cause of autism is unknown. However, possible causes include genetic problems or syndromes, exposure to toxins or chemicals during pregnancy, or severe brain infections such as meningitis or encephalitis. While there is no known cure for autism, treatment to aid in communication and social skills should begin as soon as possible. Once an SLP has figured out the unique areas of need for an individual with autism, intervention should begin right away. Treatment can include speech and language therapy, behavioral interventions, and learning how to use augmentative and alternative communication devices. Therapy should also include family members as much as possible. Because people with autism have most trouble with communication and social skills, an SLP will work a lot with those with autism to help them learn skills. An SLP can work on the following things with people with autism, and these skills may be worked on individually or in a small group. They can work on reading by looking at books and stories, writing by practicing writing letters, words, and sentences, speaking by answering and asking questions, asking for help, initiating and participating in conversation. They can work on social and behavioral skills by playing with others, following directions, and participating in joint attention. An SLP can also help a client learn to use an alternative augmentative communication device in order to help them communicate if they are nonverbal or have limited verbal abilities. And finally, an SLP can help an individual with autism with feeding by helping introduce new food or overcome texture aversions. Using interactive schedules that the child can mark off after each task can help with smooth transitions, as well as using warnings and timers. Because people with autism have a hard time understanding sarcasm and other non-concrete language, make sure to phrase directions in the simplest way possible. It may also be helpful to ask questions to a child with autism by giving them choices instead of leaving it open-ended. For example, asking, "Do you want an apple or a banana?" instead of just, "What do you want?" Lastly, teaching classroom social skills such as turn-taking and sharing will help a child with autism learn these social rules. If you are interested in learning more, visit the American Speech Language Hearing Association's website for additional information and resources. Thank you for watching this module on autism spectrum disorder.